Professor, really, now when you are start to speaking about kind of asthma which come only at night, I have this problem I didn't know before, like this is an asthma, because in my thought when I will be in touch with dust, or for example, I have a kind of asthma from dogs and cats. So I thought like in the same second I should take the effect because I'm in touch with the reason of my asthma. But a lot of the time I have this effect only at night when it's not important if I'm sleeping or not. I will have a very strong pain. I want to survive from this pain. So what do you think, doctor? How I can solve this problem? Do I need to take any kind of medicine, or just I need to care about what's around me?
And it's a very important question because I get this problem a lot of times in my clinic and people come with that. The first thing to tell you is that, usually the symptoms are present in the day and in the night, but the nighttime is worse. So it becomes more prominent in the nighttime. The symptoms, I'll take you back again, would be cough, shortness of breath, tightness in the chest. This is what you're describing. And also they can have some whistling noise in the chest. They sometimes have a throaty feel that there is something sitting here in the throat. So this is there's a throaty feeling. So these 4 or 5 constellation of symptoms are very prominent, and they suggest allergy in an individual. But the right way to go about it, if somebody comes to see me, is to do proper history taking. In the history taking, I would also want to make sure that we discuss when the symptoms are worse. Some people find when they have fragrances, they have smells, they have a varnish in the house, coloring, that makes the things bad. So this is very typical of asthma in the history that we can get. Then again, we talk about what kind of work they are involved in, what kind of work they are doing. So some people who are welders or bakers are more prone to having asthma. These are all again important. And smoking is a very, very no-no with asthma. So any form of smoking, I would try to say that please stop smoking. This doesn't help. What smoking does to the airways is the policemen of the airways go dormant and sleeping when you smoke. So this is why it makes life very difficult if you are an asthmatic and smoke. And then we go in and examining those patients in the chest, we may see how things are. But there's some very important tests to do to find out if you have allergies or asthma in the airways. So one of the tests we can do in our clinics is called FeNO, fractionated exhale nitric oxide. It's like a breath analyzing test. And we know the answers in 2 to 3 minutes time as to how bad the allergy is. We also do a spirometry checking lung volumes, and we can do post-bronchodilator spirometry as well, just to see how the airways is changing on that day. We do some blood tests. We're checking for some eosinophil count, IgE, and also we go for allergy testing, coming to the point. So the allergy testing, we can do a lot of allergy testing. We try to direct it to the needs of a patient. So if you tell me that you find dust making things worse, so certainly dust is the commonest allergen in what I've noticed in my practice in UAE. But yes, if you have a cat in the house and the cat is a new arrival, there's a suspicion that could be contributing to your symptoms. So we do cat epithelium, dog dander if you have a dog, but they have to be telling in recent arrival in the house. If they've been there 5 years, 4 years, the same dog and the cat, it usually doesn't mount to that. But it's good to have these allergy tests done, so we know black and white what you're allergic to. Now, say for instance, if you are allergic to dust, then the question is how do you protect yourself? And even with the same cat or dog, how do you go about things? So I say to my patient that you have to find a good house for your cat or dog, and have to be having some distance, because if you are near the pet, the fur will go into the airways, start the cascade of reaction, which are allergic reaction. For dust, we've covered in podcast earlier that it could be indoor dust or outdoor dust, and you have different strategy to adapt to both these kind of problems. But then again, I've talked about house dust mite, which is a very tiny creature which can creep on the bed, doesn't harm you in any ways, like doesn't go into your body, but when it goes up in the atmosphere you're sleeping in and you inhale it, starts the reaction. Reaction could be very quick and can take a little longer time, can take half an hour or so to normally develop these symptoms. So nighttime symptom usually is considered not a very good sign, because that would suggest that the asthma or the allergies are high or the control is not good. So, but then daytime and nighttime symptoms do coexist, but more pronounced at day or night. This could vary.
So, doctor, also I need to ask you. So, what do you think at night if someone will have this problem? What is the best way to protect? Yeah.
Exactly right. Well, good question, because we have covered till the investigative work what we do, but then comes what is the solution apart from trying to avoid the allergen. The important thing is the treatment. And today's day and age, the asthma is completely controllable. The symptoms can be completely controlled. So those olden days that the asthma sufferers would not play rugby, would not play football, would not. This is not the case today. My patients are competing in athletics. They are doing yoga, and they are also doing marathon runs. So one of my patients who very bad symptoms now doing Dubai Marathon. So we can make them so good. So this is very important that these patients come to my clinic, have these tests done, proper investigative workout, and then we give them the treatment. The normal treatment which works well is a combination of inhaled corticosteroid with a long-acting bronchodilator. It usually comes as an inhaler called Baha. So it is easy to use, but I prefer it to be used through a spacer device. I mean, obviously it depends on the patient. Younger patients, I would have a different inhaler. But that's the normal inhaler I would use, which is a PMDI device attached to a spacer. The reason is that this spacer makes the small particles of the inhaler go deep into the lungs. And I've just touched on the size of the dust is very, very small, and the airways less than 2 is a small airway. So it gets landed up there. So really whatever inhaler we are giving should affect these small airways, open up these small airways to get good improvement. So we combine it with a tablet called leukotriene inhibitor, which you take at night time, and also an inhaler which is antimuscarinic agent. The simple thing to understand is that we are trying to open up the airways in these individuals, but we are doing 3 routes. So all these 3 things treatment-wise we've discussed have different pathways, but they do the same job, opening up the airways, drying up the bulgum and the secretions. And that has a very positive effect on improving. But now for last 15-16 years, we have a new treatment in asthma, and especially geared up to moderate and severe disease. It's called biologics in asthma. This is like a breakthrough in asthma treatment and care. So people who qualify for that do take these injections. They could be a monthly injection or 2 monthly injections, and they can learn to give it at home. They don't need to come and see me in the clinic. But the way they control is that they have 0 symptoms. So we are living in that era where the tablet form of steroids used to be the main, highest treatment we could give severe asthma. But these days that is not required. You can use biologic in these patients. And so we avoid exacerbation, we avoid our hospital admissions, and we avoid using tablet steroids for a long run. So there is a revolutionary kind of treatment now available. We have about choice of 5 to 6 biologics. And we have our patients on that. It's a fairly safe treatment, but a fairly new treatment as well. So this is what I'm saying. A specialist has to be involved when you have those symptoms, and once the right investigative workout and right treatment is given, symptoms could be completely 0. You can have completely normal life in today's day and age. And it's a step-up treatment depending on the need, or step down as things are controlled. That's how we manage the allergies and the asthma.
So with this new technology, what you told us about, so anyone, he can complete his life normally without any problem. He can complete his work even if he is working outside for a long time, and the symptoms, it will be under control.
Yeah, so the basic treatment again has to be there, but then we step it up. So first we gave the inhaler, which is bronchodilator with the inhaled corticosteroid. The next thing is a tablet form of which you take at night time. The next one is anticholinergic inhaler. So all these 3 are doing the job. But if the 3 are not enough and you still have symptoms, you still have problems, then where do we go next? So in a short run, we can give steroid tablets. But in a long run, when we have to control these symptoms, prevent hospital admissions, prevent emergency visits, prevent the steroid tablets to be used for a long run. So when it comes to that kind of thing, we can then consider this treatment that I've just talked about, is biologic treatment. Technically, it's monoclonal antibodies against certain cells which cause the allergy. It's like a precise treatment. And these are the cells called cytokines. So all these things are covered by this good new treatment. It's a very expensive treatment, so we have to tailor it to the needs of the patient. But the patients who are on that has used it safely and has very, very good results. So today's day and age, if people have allergies, once they've consulted a good pulmonologist, I am very hopeful and very sure that we can control their symptoms to a very good level. Though it's a chronic disease which can go away and come back, it waxes and wanes, good days and bad days. But with good treatment, today's day and age, nobody should feel I'm handicapped if I have asthma or allergy in the airways. So that's the message I want to convey.
Doctor, I also need to check out with you about what the difference will be between summer and winter, because I really feel it, but I didn't focus. Like, I think in summer it's more stronger, or not.
No, this is very good question that you've raised here. That in the summertime, I touched on between say for instance April to September, the temperatures go quite high, especially June to September. Temperatures are very high, but the humidity also goes to about 70% in the atmosphere. So when the temperature goes up, the humidity goes up. There's a lot of dust particles in the atmosphere outside. So if you have to go outside, I would suggest, as I told you earlier, to check air quality index before making a plan to go outside. And if you have to go, then you wear a proper protection when you go out in the open. And the same with this, that you restrict the time you're outside there. So at least from 11 o'clock to 3 o'clock, do not go outdoors, and maybe you can do outdoors later. So the winter has its own problem and summertime has its own problem. But summertime here in the UAE has these kind of effects as well. So if you have to go outside, you have to make sure your inhaler or your asthma treatment is with you and you're regularly taking it. Because a lot of people, as I told you earlier, 80% of asthmatics land into emergency department during this time, the summertime. And in the summertime, we get desert storms as well. And desert storm happen because of the temperature changing so rapidly. The air comes in and it blows the dust. So the dust can go to about 1 kilometer, longer than that, even spread out. And so it becomes difficult for people who are allergic to dust and have asthma. So this is why they have to be very careful, especially this summertime period. Now the winter time period, there are some other difficulties, especially the viruses like September, October or October time. A lot of viruses and flu illnesses around. So for asthmatics, I do recommend a vaccine, a flu jab vaccine, to be taken around that time. So it protects at least some degree of protection to these people who would get flu, and flu is a trigger. So we're talking about dust as a trigger. There's also other things that can be triggered, a bacterial infection, a viral infection. It triggers it. And this is a cascade of reaction going on. Until we get the right treatment, things don't improve. And cough sometimes is the only symptoms or very... other symptoms are less common. The cough is very high on the dust allergy in our atmospheric condition. So yes, there is a big difference between the hot climatic condition and slightly less hotter climatic condition, and we have to be very much geared up for this. Have plenty of fluids, have loose clothing, have your inhalers with you, make sure you're taking your treatment regularly, and also looking at the air quality index, assessing the air quality, and then deciding about going out. So restricting. Nighttime, the desert storm don't usually happen. It's in the daytime they happen. So again, you can plan accordingly your work if you have to go outdoors. But yes, the climatic conditions can affect adversely the asthma patient. Winters could have another effect, a different type of effect. I told about the viral flu illnesses and things like that. But then has to be prepared and should have a care plan with you as to what to do when things are not good, or what kind of treatment to take when things are not going good. So yeah, it's a very important question that you raised, but I hope we covered this.
Yeah, thanks a lot, Professor, for all the information what you gave us, and it really was so important to go in all of these details because really we need it in our life. Thanks a lot.
Thank you very much. A pleasure with you.